First, I would wash my hands to keep down the spread of germs. Next, I'm going to introduce myself. Hello, Ms. Walker. My name is Jermeka Marks. I'm a registered nurse, and I'm going to do a physical assessment on you today. And it shouldn't take any more than about 15 to 20 minutes. Is that okay with you?
Yeah.
All right. Next, I would take vital signs, and I'm going to just verbalize her vital signs. Her blood pressure is 120/80. Her heart rate is 76. Respirations are 18. Temperature is 98, and her oxygen saturation is 100%. Do those sound like they are within your normal range, Ms. Walker?
Mm-hmm.
All right, the vital signs are within Ms. Walker's normal range. Next, I'm going to assess her skin. Can I take a look at your skin? Her skin is brown and smooth, free of lesions, no tattoos present. I'm going to go ahead and check your nail beds. Capillary refill is less than 3 seconds. Nail beds don't have any clubbing. They are pink. Everything looks good. I'm going to go ahead and check your skin on your legs. Free of lesions, smooth brown. And I'm going to check your capillary refill on your toes. No clubbing of the toes. Capillary refill bilaterally is less than 3 seconds. Next, I'm going to move to the head. Her skull is normal cephalic. Everything looks symmetrical. Next, I'm going to move to the scalp. It is pink and moist, free of lesions. No abnormalities noted in her scalp. Her hair is next. It's evenly distributed. No missing spots. Her hair is curly. It is soft. And it is just a little bit oily. Next, I'm going to check for cranial nerve number 5. That's the trigeminal. Can you close your eyes for me? All right. Where am I touching?
My right cheek.
All right. What about now?
Left side of my chin.
All right. Cranial nerve number 5. The trigeminal is intact. Next, I'm going to check for cranial nerve number 7. That is the facial. Can you clench your teeth for me? All right, cranial nerve number 7 facial is intact. I've already checked her nails for any clubbing and capillary refill. Next, I'm going to move to the eyes. Her eyelashes are inverted. They're evenly distributed. They're symmetrical. Her eyebrows are symmetrical, evenly distributed. Hair is evenly distributed. Her eyes are on the upper third of her face. Her nose is midline and her mouth is in the lower third of her face. Next, I'm going to have you cover your right eye and read from the index card. Recorder, can you hold the index card up, please? Can you read the first line of the card?
The car is yellow.
All right, switch to your other eye for me.
The grass is green.
All right, cranial nerve number 2 optic is intact. Next, I'm going to check for cranial nerve number 3 oculomotor. I'm going to check for cranial nerve number 4 trochlear and cranial nerve number 6 abducens. Can you follow the pen with your eyes for me, please? All right. Cranial nerves 3, 4, and 6 are all intact. Next, I'm going to turn the light off and check her pupils. All right. Pupils are equal round reactants to light and accommodating. They are brown in color, they are round, and they are both equal. Next, I'm going to check her ears. Her ears are symmetrical, elastic with rapid rebound. I'm going to check with my light. There's no ear sound present in the outer lobes. She has piercings present in both ears. All right, now I'm going to have you cover your left ear and I'm going to whisper something in your right. All right.
Bumblebee.
All right, switch to the other side for me.
Housefly.
All right, cranial nerve number 7, vestibulocular, is intact. The patient is able to hear equally. Next, I'm going to look at her nose. It is midline on her face. Can you cover one nostril and sniff for me, please? All right, cranial nerve number 1, olfactory, seems to be intact. I'm going to check your sinuses. Do you feel any tenderness when I touch? All right, her facial and maxillary sinuses don't have any tenderness upon palpation. Next, I'm going to check her mouth. Can you open your mouth for me? Her teeth are white in good repair with no dental problems present. Her tongue is pink, moist, and smooth with no coating. Her gingiva are pink. Her buccal mucosa is pink, smooth, and doesn't have any lesions present. And next I'm going to check cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 12, hypoglossal. Can you stick your tongue out for me? All right, can you give me a smile? All right. All these cranial nerves are intact. Patient doesn't show any signs of facial drooping or asymmetry. Next, I'm going to assess the neck. The skin is brown, continuous with that of the face. Can you lift your head back like this for me? Forward. Okay. Neck has full range of motions. Next, I'm going to test for cranial nerve number 11, the accessory. Can you raise your shoulders up against me? All right. Next, I'm going to palpate the left nose.
Excuse me.
The occipital, the submandibular, the submental, the supraclavicular, the occipital, the pre-auricular and the post-auricular, and I don't feel any palpable lymph nodes. Next, I'm going to palpate the carotid arteries. Pulses are strong and equal on both sides. I don't hear or feel any bruits. Next, I'm going to auscultate. If you would hold your breath when I tell you to. Hold your breath for me. And again. Next, I'm going to inspect the lungs and the thorax. Can you lean forward for me, please? I'm checking the spine. It's S-shaped, midline of the back. No lumps or pain. Do you feel any pain when I touch your spine? All right. Next, I'm going to palpate the chest on expansion. Can you take a deep breath for me? Okay. No tenderness felt when I did that, correct? Next, I'm going to percuss the lung sounds. There's resonance heard over the lung areas, which is normal. Next, I'm going to auscultate the lung sounds. Okay, take deep breaths for me. And again. Lung sounds are clear upon auscultation bilaterally with no adventitious sounds. Next, I'm going to talk about the breast assessment. Upon breast assessment, I would have the patient to remove her shirt. Then I would check for symmetry of the breasts to make sure they were equal on both sides. Then I would have the patient sit in 3 different positions, leaning forward, straight up, and lying back to assure that the symmetry of the breast is maintained. And I will also look for any abnormal findings such as dimpling, everted or inverted nipples, any lumps or bumps of the breast that might occur with position change. Afterward, then I would palpate the breast to check for any lumps, bumps, or any abnormal findings. I would use the circular motion or one of the other 2 methods that you can use to palpate the breast. And then I would squeeze the nipples lightly to see if there's any discharge. In addition to the breast assessment, I would check for the axillary lymph nodes and check for any tenderness or any lymph nodes that might be present in the lateral or central areas. Next, we're going to do the mental status exam. Can you tell me your name?
Denise Walker.
Do you know where you are, Ms. Walker?
The doctor's office.
Do you know why you're here?
For a physical exam.
And do you know what the year is?
2018.
The patient is alert and oriented ×4. Next, I'm going to have you recall 4 words later in the assessment. I want you to remember car, blue, seed, and bird.
Okay.
Moving on with the mental status exam. Her facial expression is normal. Her speech is clear and appropriate. Her attention span has been appropriate throughout the entire assessment. Can you recall those 4 words for me?
Car, blue, seed, bird.
Her remote and recent memory are both intact, and that concludes the mental status exam.